name is Robbie Furman, and I'm with Erickson Advantage. And today we're going to be talking about Medicare Part B, which is the doctors and the outpatient procedure portion of part of Medicare. So to get started, I'd like to introduce our guest again with us. This is Dottie Cressline, who's a resident here at Charlestown. Yeah. And Dottie's going to be here to just basically getting a good understanding and see if she has any questions.
Actually, to find out a lot of information that I don't already know.
Yeah, exactly. So again, today we're just going to have a conversation to understand how Medicare works. And one of the things we're going to be talking about too is in our last show, is the premise of what happens if you only have Medicare, okay? We're thinking maybe you do not have a secondary, do not have other insurance. So we're going to be thinking that way, if you only had Part B. So to get started, one of the things we're going to be talking about, okay, is what's covered under Medicare Part B is what's known as medically necessary services. Mm-hmm. So it's very much important to understand is that sometimes when a person feels that, hey, I think this should be covered under Medicare, there are some gray areas where Medicare says, we do not cover that service. In fact, later in this program, we're going to run down some of the different different things that are not covered under Medicare. Okay, and one of the also things that Medicare now covers, there was a time that they did not cover this, is known as preventative services. And preventative services are things like a mammogram, a bone density test, okay? So that's covered under Medicare now.
Yes.
Yep, mm-hmm. So that's very important to know. In fact, every year, Medicare puts out a book called the Medicare and You book. Okay, we all get it in the mail. Mm-hmm. We open the book and go, what do I do with it, right?
That's right.
And we put it in that bottom drawer. But the one thing very important to know about in that book there is a page that does talk about all the preventative services that you can get under your Medicare, okay?
Correct.
And again, some of those services you ask your doctor about, okay? Some of them the doctor may say, yes, let's order one of those tests. Other times, maybe not necessary, okay? So that's just to let you know that is covered under Part B of Medicare. Now, one of the things to know about Medicare is Medicare Part B has a premium. Now, this is the last couple of years, Medicare has been changing the premium amount. So you might have noticed, and the premiums, and regardless if you have what's known as an Advantage plan or if you have a supplemental plan, every person in America who is on Medicare, for the majority of the people, will have a Part B monthly premium. A couple of years ago, it was about $104.90. Last year, yeah, you remember that number?
Yeah, I sure do.
Yeah. Last year, most people were paying about $109. Mm-hmm. So this year, there are people who are paying up to $100 or starting at $130. So there's a little fluctuation of maybe what you're paying, what your neighbor is paying, but Medicare Part B always has a premium, okay?
Yes.
And that's something that it will always be, okay? And there's no way around it, let's put it this way, okay? So Medicare Part B does have a premium. Now, one of the things we were just mentioning about Medicare has its premium, there's something out there called IRMA. And now IRMA, what that stands for is Income Related Monthly Adjustment Amount, IRMAA.
I'm not familiar with that.
IRMA, I hate to say it, is not your friend.
Okay.
What IRMA is based on your income.
Okay.
So what IRMA does is this. Based on your 2016 income tax returns, 2016, 2 years back.
Yeah.
Social Security looks 2 years back. If you as an individual made more than $85,000 per year, that's your income, instead of paying that $109 per month, you would be paying about $134 a month.
Okay.
Now, if you made, let's say, $107,000 a year, and then we're looking off of the chart that you're seeing right in front of you right now, as you can see, if you made over $107,000 a year as an individual, instead of paying $134, you might be paying $267.90 per month. Okay?
Whoa.
And this is based, again, on your income tax return 2 years ago. The highest level that it goes up to, and I just spoke to somebody on the phone recently, this person makes over $214,000 individually, just single.
Right.
She's paying per month $428.60 a month. And the reason I bring this up is there's a lot of confusion where somebody says, wait a minute, oh, I've never had to pay all this money. This is ridiculous. What's going on? Well, maybe 2 years ago something happened. They might have inherited some money. Maybe they sold a piece of property, cashed in a investment property or investment type of vehicle, and that money that they put in their bank, again, counts as income. Okay? So their Part B shoots up. Okay? And keep in mind, it's only for that fiscal year. Maybe in 2016, you had a very good year, but the next year in 2017, maybe you bought some things or put your money other places, and now your income tax return is lower. And that's where you might go down to a lower bracket again. Okay?
Whoa.
And
Yeah,
again, it's a little confusing. Again, this is what's known as IRMA. This is the rates of what you pay is set up through Social Security.
Yes.
And Social Security and Medicare work hand in hand together. Okay? So that's something I'd recommend if anybody has any questions about the IRMA or what rate, why they're paying that. You could see one of the Erickson Advantage sales representatives in your community.
Yes.
Okay, and they can help walk you through the steps of understanding of what you're paying for that.
That's very interesting.
Okay.
Yes.
So the interesting thing too is we talked yesterday, the last program was that Part A of Medicare has a deductible.
Yes.
Okay, the deductible, one thing I didn't talk about was that the deductible with the Part A of Medicare, you might have to pay that deductible a couple of times during the year.
That's
Okay, that's something important to know. That's, again, if you only had Medicare, no other insurance, you might have to pay that deductible a couple times a year for Part A.
okay.
Okay, Part B of Medicare has a deductible also. The Part B deductible is only once per year, though. Okay,
And what is that based on?
that one is a flat fee. Every person who has Medicare would have this deductible. It's $183.
And when did they take that?
That's a great question. Generally, if you, let's say, have a plan that does not cover the deductible, and what I mean a plan is Medicare does not cover the 183, but your secondary might cover the 183.
Ah.
Okay, it's good to learn, does it cover or does it not? There are certain plans that do not cover the deductible. And how it's taken out generally is what a deductible is. That's the amount that you pay first before Medicare starts to pay.
Aha.
And generally, if you have your first doctor's appointment, January 5th, you go in the office and you're ready to pay your $20 copay or $35, whatever it is, and they say that's going to be $140, please. $140? That's ridiculous. How come I'm paying this month? The reason being is you're paying $140 towards the $183 deductible. Okay?
But you would know that.
A lot of people don't. They come home and they're like, wait a minute, or they might get a bill from the doctor and say, I thought we're not supposed to pay anything. Again, it's good to learn about what secondary insurance you have to figure out, are you responsible or are you not? So that's the best to learn about your own insurance.
Yes, yes,
Okay?
yes.
So that's a once a year, the $183 deductible. And the one thing we've been talking about is, again, there's what's known as co-insurance through Medicare. What the co-insurance is Medicare pays generally 80% of a person's doctor or outpatient bills. Okay, generally it's about 20%. Okay, so the co-insurance is you have to know under your plan what type of co-insurance or co-pays you might be having. Some plans you have none. The plan covers, your plan might cover everything. Other plans you might have a copay, but it's very important just to learn about the different things where the person might be out of pocket. again, for a hospital stay, might be for an outpatient stay, okay?
How do you check on that, Robbie?
Yeah, the best is to always pick up the phone once a year, and generally each year you're going to get new information from your health insurance company. And the best is to reach out to your insurance company and just ask them some basic questions. And you know what it is too is, Dottie, reason we're doing these shows is the most frustrating thing, I think, when a person gets on the phone, it's not understanding the answers they're getting. The frustrating is what questions do I ask? Okay? People get on the phone, I have a question. Okay, what's your question? I don't know.
I guess,
That happens.
Yes.
So that's where it's good to really start getting an understanding of how your secondary insurance works with Medicare.
Yes.
Okay? So because the one thing, and I know I myself and I know a lot of our residents do not like this, surprises. I like no surprises. I like to know going in what to expect. And at least I know what to expect. I feel much better than surprise. So very important to do a little research on your own insurance. Okay. The next thing we're going to talk about is, we mentioned this at the beginning of the show, is there are certain things that Medicare does not cover, even though we may say that's medically necessary. We need to have that service. Medicare, unfortunately, is the ultimate authority, and if they do not deem something medically necessary, then it's not covered under Medicare in most circumstances. Just to let you know, the one thing that's not covered under Medicare is long-term care, okay? Or assisted living, okay? This is not covered under Medicare, okay? Most dental care, and the reason I say most dental care is there are certain Advantage plans out there, Medicare Advantage plans, which we're going to be talking about in our next program. But Medicare Advantage plans do cover some preventative dental, okay? But Medicare as a whole does not cover, okay? Eye examinations related to prescribing glasses. Now, if a person has macular degeneration or glaucoma, that's covered under Medicare. But having just your regular eye exam, just to check your eye, a routine eye exam, is not covered under Medicare as a whole, but some Advantage plans also will cover the glass checkup.
Can I interrupt you a minute? Is there a book of something that could explain that, you know, where you could go through and say, does it cover?
Well, generally, this is also going to be in the Medicare and You book also.
It is?
It is. Also, again, it's good to check with your plan. These are the questions. Hey, just go write down the list of the things you see right on your screen. Does my plan cover this? It's always good to ask. Okay? Dentures. Okay, Medicare does not cover dentures. Cosmetic surgery, not covered under Medicare, nor is acupuncture. A lot of people go to an acupuncturist and they say,
that's surprising.
That's not covered under Medicare. Hearing aids and exams for fitting them, again, under most plans, they do not cover hearing aids or the exams. Under Medicare Advantage plans, they do offer extra benefits on the hearing aids and the exams. Okay, and also routine foot care, and this is one of those things I hear from all the people I talk to. What routine foot care is that's a podiatrist who's just checking out your feet. Now, if a person has diabetes or foot issues, that will be covered under Medicare because it becomes now preventative services. But what the biggest thing is that some people may get their toenails clipped at the podiatrist, and they might get a bill for $12. What's this $12 bill? I thought this was covered under my insurance. Again, toenail clipping is not medically necessary. So a person may receive a bill from their podiatrist. Under some of the Advantage plans, again, they do cover the routine, as the word is known as, podiatry visits. So
Medicare Advantage is a subsidy.
Right. So Medicare Advantage, but we're going to talk about that on our next show. But just, it's a great question that's coming up, and I know it's been coming up in our shows. See, there's two different ways to get your Medicare. Okay. One is going to be called Original Medicare, which is Medicare Part A and B, a supplement, and a standalone prescription drug plan. That's known as original Medicare.
Okay.
Or if you take all of those things, roll it up into one ball, you get Part C of Medicare. And we're going to talk about that on our next show.
All right. Okay.
Okay? So these are the items on your screen you saw that are generally not covered under by Medicare. But again, my recommendation, check with your own policy to see what are any of those covered. You may be surprised to find out it's yes or no. So it doesn't hurt to ask.
Yes.
The next thing I just wanted to talk about is the doctors themselves. Part B of Medicare covers the physicians and covers the outpatient facilities, okay? So one of the things very important to know is there are 3 different doctors out there. I'm not talking about podiatrists or endocrinologists. I'm talking about how do the doctors accept Medicare? How do they work with the Medicare system? So first doctor is a doctor who accepts assignment, okay? And what assignment is this? If anyone has ever seen those evidence of benefit statements, you get them in the mail, they say, this is not a bill.
Yes.
Okay? Those statements will tell you how much the doctor receives from Medicare. Now, on the top of those bills, if you look from the left to the right, the first thing you'll see is provider billed. Okay? The doctor is the provider.
Yeah.
He might have billed $300. Okay? The next column you'll see will say Medicare approved. Okay? Medicare approves 80%. Or I'm sorry, let me take that back. Medicare doesn't approve that $300. Medicare says, well, that's wonderful, the doctor charged $300. That Medicare only approves or allows the doctor to charge $100. Okay? So the doctor, the first line again, not to make it confusing, provider billed, okay? Okay? Medicare approved $100 of the $300, and then you'll see in the third column, Medicare pays 80% of the approved amount, okay? And then you'll see the next box, it'll say, you may be billed. That's where it's always confused. This is not a bill, you may be billed. Which one is it? Okay? And that's where it shows the 20% not covered by Medicare. Now, if the doctor accepts assignment, okay, the doctor will take $80 from Medicare and will get $20 somehow, either through you have a copay or you have it'll be covered under your insurance. So it's very important to understand that a doctor who accepts assignment will get paid, again, 80% from Medicare and 20% from somewhere else. So in terms, he'll get his $100. Okay? Now, this is interesting.
Yes.
Okay? There's a doctor who does not accept Medicare assignment.
Yes.
Okay? And now this is the
I
very...
have run into that.
Yeah, this gets a little bit confusing because people sometimes will call on the phone and say, do you accept Medicare? Okay? And yes, we do. Absolutely. Oh, wonderful. You get to the doctor's office, you go in, you show them your insurance card, and they sometimes will say it'll be $15. So wait a minute, I thought this was covered on my insurance. See, now a doctor can choose, this is important to know, to not accept Medicare assignment. This is the second kind of...
He can...
Yeah, he could say, the money that you're going to pay me, I don't accept it. I want more money. Okay? So a doctor can do this. Let's take the same scenario. Provider billed $300. Medicare approved $100.
Yes.
The doctor can choose to charge 15% over what Medicare approves. They can choose to do that. The reason being is maybe you have a doctor who's been working as his profession for 40 years. He knows his stuff inside and out. And last month, the new doctor who just got out of medical school, who does the same type of profession, he opened across the street. He's been practicing for 6 months. So the doctor might say, wait a minute, I'm getting paid the same as him? So the doctor might choose to charge above what Medicare approves, which is perfectly legal. And many people don't know this.
It's legal?
It's perfectly legal. This is approved by Medicare. Medicare allows the doctor to charge 15% over the Medicare approved amount. And here's the most important thing is Medicare does not cover the excess charges.
And you would not know that up front, would you?
No. So that's something where it's very important when you call your doctor or the new doctor to say, does the doctor accept Medicare assignment? That not just Medicare, because this
Medicare
doctor
assignment.
Exactly, because there are doctors, yes, they take Medicare, and also yes, they charge above what Medicare approves, which is again the maximum they can take is 15%. So again, you'll be paying. So if it was $100, Medicare approves on 80, pays 80, your secondary 20, and you have to find out, does your secondary pay those excess charges? Okay?
And again, good info.
That's
good
something very
info.
Okay? And that's the thing. Now, those are 2 doctors, and I told you there are 3. And that's the 3rd doctor, the doctor who does not accept Medicare. There's doctors out there, there's some what known as boutique doctors. These doctors may be specialists of the specialists, the top. Some doctors will say, we are cash only, and they'll even have you sign a paper that says, if I will see you as a patient, you will not bill Medicare. Okay, so this is important. Doctors who do, and they can choose to do this. A doctor who has enough business without having Medicare recipient, he doesn't need to take Medicare. So that's why it's very important to know the 3 doctors out there. Whether the doctors who accept Medicare, or accept Medicare, don't accept Medicare, the ones who accept assignment and the ones who don't accept assignment, okay? And it's very important to find out.
Is that something that, if you were calling a new doctor, is that something you would ask them?
Absolutely. Absolutely. You say, do you accept Medicare assignment? They're going to say one of 3 things. Yes, we accept Medicare and assignment. No, we don't accept Medicare assignment, but we do accept Medicare.
Gotcha.
Or 3, we don't accept any of it.
Okay.
See, a little confusing,
right? Yeah, but interesting.
And you know what the biggest thing to know is, okay, so God forbid you did go to the hospital, have to pay to the doctor's office. You did pay that $15. Okay, big deal. I paid it. I'll learn my lesson next time. Here's the thing to know. You could be in a hospital setting, and the anesthesiologist that day wasn't the regular anesthesiologist. They had to bring somebody in. Well, guess what? He may not accept Medicare. I was just going to say, oh my. And his bill might be Medicare, he charged whatever. His bill could be $1,200 above.
Isn't that something he would have to tell you?
No. Not always. Or there are times where I talk to people where you're right, you should not have to pay that bill. But the doctor still sends it anyway. And you get a bill, like, what is this, $900? I better pay it. Okay? Lots of confusion. Lots of confusion when people are coming out of a hospital setting and they're not 100% sure. Am I supposed to pay this or not? That's why it's good to be talking to your insurance company. Okay, your Medicare you can talk to, but also your secondary insurance company and getting information from them. Am I responsible for this bill? Well, sometimes yes, sometimes no. But that's again where you must do some research with your own insurance company and have these conversations. So remember before I was asking, what question should I ask? Here are the questions.
Wow.
Does my insurance cover this? Do I have any co-pays? Do I have that? Very important because again, I don't like surprises.
Well, it makes you kind of suspect, actually. I'm sitting here thinking you've got to be more complete.
Well, think about this. You know what it is more than anything else? Too many people say, they say, what insurance do you have? I have, I don't know, I keep the card in my wallet. But beyond what the name of the insurance is, a lot of people have, I don't know how it works. And that's why we're doing these programs.
This is great. This is great.
No, and there's the last slide that I have is basically always just doing some research, finding out, again, about your insurance, about what kind of insurance you have. Either there are people who are self-pay, and I mentioned before, I meet a lot of people say, I only have Medicare. That's a choice.
That's up to them.
Some people will choose to have a supplemental plan or a Medigap plan, they're known as. Or some people could choose to have what's known as a Medicare Advantage plan.
Yes.
So that's a choice, and my recommendation is for people to learn. Right, suit yourself.
Absolutely.
But learn. Nothing hurt to ask questions. And which leads us up into, if you have any questions about Medicare or have questions about the insurance that we sell right here in the community, known as Erickson Advantage, please go ahead and call the number on your screen and talk to one of our member services representatives or our health insurance resource managers right here in your community.